You lie down, everything gets quiet, and suddenly your heart feels loud. Maybe it's a thump, a flutter, or a pause that makes you sit back up. If that's you, the first thing to know is this. Palpitations when lying down are common, and they're often explained by normal body mechanics. But common doesn't mean you should ignore patterns that worry you. In the next few minutes, you'll get a clear mental model for why it happens, what's usually harmless, and what deserves a checkup. We'll also go through practical ways to reduce the sensation without doing anything extreme. The goal is simple: help you feel safer at night and make your symptoms more predictable. Start by remembering that a palpitation is a feeling, not a diagnosis. It can come from a normal heartbeat you're noticing more, or from an extra beat that's actually quite common. The key is context: when it happens, what it feels like, and what else is going on in your body. Moving to slide 2. Let's define what you're feeling in plain language. Palpitations usually mean you're aware of your heartbeat. That awareness can feel like pounding, fluttering, skipping, or a brief drop in the chest. A big reason it feels intense at night is contrast. During the day, movement, noise, and distractions mask subtle body signals. At night, your attention turns inward, and the same heartbeat can feel amplified. There's also positioning. When you lie on your left side, your heart sits closer to the chest wall, so each beat can feel more noticeable. And when you're still, you can detect tiny rhythm changes that would be invisible while walking around. Importantly, the sensation doesn't automatically mean something dangerous is happening. Many people feel occasional extra beats, called premature beats, and they're often benign in otherwise healthy hearts. The real question is whether the palpitations come with red flags, happen frequently, or are linked to specific triggers you can change. Moving to slide 3. Now for the first big mechanism. Blood flow shifts when you lie down. When you stand, gravity pulls blood toward your legs. When you recline, more blood returns to your chest. That increased return can slightly stretch the heart chambers and change how forcefully the heart contracts. In some people, that stronger contraction is felt as a thump, especially after a long day on your feet or after dehydration. You might also notice it after a hot shower or alcohol, because blood vessels relax and your body compensates. This is one reason palpitations can show up right at bedtime, even if your heart rhythm is normal. It's not that your heart suddenly became worse, it's that the plumbing and pressure system changed position. If you're sensitive to internal sensations, that shift can be enough to trigger worry, which then adds adrenaline and makes the heartbeat even more noticeable. So the first takeaway is simple: posture changes circulation, and circulation changes what you feel. Moving to slide 4. The second mechanism is pressure and contact. When you lie down, your chest and abdomen positions change, and that can physically transmit heartbeat sensations. A full stomach can push upward on the diaphragm, making the heart feel more present. Gas and bloating can do something similar, especially after a large meal. Even tight waistbands or certain sleeping positions can increase the feeling of pressure in the upper abdomen and chest. For some people, this isn't about the heart at all. It's about the surrounding structures making normal beats easier to notice. This is also why palpitations may feel worse when you curl up or lie flat versus slightly elevated. If you've ever noticed that the sensation improves when you sit up or roll to the other side, that's a clue that mechanics are playing a role. The practical implication is encouraging. Small changes in meal timing, posture, and comfort can reduce the signal your brain is picking up. Moving to slide 5. A very common contributor is reflux. Acid reflux, or what some people call heartburn. Reflux can irritate the esophagus, which runs right behind the heart. That irritation can create chest discomfort that your brain interprets as heart stuff. Reflux can also trigger vagal nerve responses, which can change heart rate and make extra beats more likely in some people. The tricky part is that reflux doesn't always burn. It can feel like pressure, a lump in the throat, coughing, or a sour taste. And it often gets worse when you lie down because stomach contents move more easily upward. If your palpitations cluster after late meals, spicy foods, alcohol, or when you lie flat, reflux is worth considering. This doesn't mean you should self-diagnose. It means you should look for a pattern. Palpitations plus upper stomach discomfort, burping, or throat symptoms. Addressing reflux triggers often reduces nighttime palpitations for many people. Moving to slide 6. Let's talk about rhythm basics without getting technical. Many nighttime palpitations are premature beats, an early beat followed by a slightly longer pause, then a stronger beat. That stronger beat is often what you feel. Premature beats can come from the upper chambers or the lower chambers, and in many healthy people, they're benign and come and go. They can be triggered by stress, poor sleep, caffeine, alcohol, dehydration, and even intense exercise earlier in the day. What matters is frequency, symptoms, and your personal risk factors. If the sensation is occasional and you feel otherwise fine, it may be more about sensitivity than danger. If it's frequent, new, or paired with dizziness or chest pain, that's different. The useful move here is to describe the pattern accurately. Is it a single skip, a brief run of fast beats, or a steady pounding? That description helps a clinician decide whether you need monitoring like a Holter or a vent recorder. Moving to slide 7. Another big category is the stress response. When you finally lie down, your mind can replay the day. If you're already worried about your heart, you start scanning for sensations. That attention increases arousal, and arousal increases adrenaline. Adrenaline makes the heart beat faster and harder, and it also makes extra beats more likely. This can create a loop. You notice a flutter, you worry, your heart speeds up, and the sensation becomes even more convincing. The goal is not to calm down by force. It's to break the loop with simple, repeatable cues. Slow breathing helps because it shifts the nervous system toward a more relaxed state. A steady exhale is often more effective than a huge inhale. Also, naming what's happening can help. This is a palpitation sensation. I can observe it. That tiny mental step reduces the threat signal. Over time, less threat means fewer stress-driven palpitations at night. Moving to slide 8. Stimulants and timing matter more than most people think. Caffeine can linger for hours, and some people are very sensitive even to small amounts. Nicotine is also a stimulant, and it can increase heart rate and trigger palpitations. Alcohol is complicated. It can feel relaxing at first, but it can disrupt sleep, dehydrate you, and in some people, increase irregular beats, especially later in the night. Certain pre-workout supplements, decongestants, and energy products can do the same. Even chocolate can be enough for sensitive people. The most useful approach is not perfection. It's a short experiment. Pick one variable, like no caffeine after late morning or no alcohol close to bedtime, and watch what happens for a week. If your palpitations drop noticeably, you found a lever you can control. If nothing changes, you move on to the next lever without guessing. Moving to slide 9. Breathing and sleep-related issues can also play a role, especially sleep apnea. With sleep apnea, breathing repeatedly pauses or becomes shallow. Oxygen can dip, and the body releases stress hormones to restart breathing. That surge can trigger palpitations and a racing heart, often noticed when you wake up or when you're drifting off. Clues include loud snoring, gasping, morning headaches, dry mouth, and daytime sleepiness even after enough hours in bed. You don't need to diagnose yourself, but you can take the pattern seriously. If palpitations happen with nighttime awakenings, sweating, or a sense of choking, it's worth discussing with a clinician. Even outside of apnea, overbreathing, fast, shallow breathing can change carbon dioxide levels and make the heart feel jumpy. A slower pace with a longer exhale can reduce that wired feeling. Sleep quality is not just rest. It's heart rhythm stability for many people. Moving to slide 10. Let's get very practical. What can you do in the moment when palpitations hit after you lie down? First, change position. Roll to your right side or elevate your upper body slightly. Second, slow your breathing with an emphasis on the exhale. A simple pattern is inhale gently, then exhale a bit longer, and repeat for a couple minutes. Third, reduce the checking behavior. Constantly taking your pulse can keep the alarm system turned on. Instead, set a rule like, I'll observe for 30 seconds, then I'll return to breathing. Fourth, consider your last 2 hours. Was it a big meal, alcohol, heavy dessert, or intense stress? That helps you label a trigger rather than catastrophize. And if you feel lightheaded, have chest pressure, or feel faint, don't try to power through. Those are reasons to seek urgent care. The goal is a calm protocol you can follow without improvising at 2 a.m. Moving to slide 11. Now zoom out to prevention. Start with hydration and electrolytes, because low fluid volume can make the heart work harder and make beats feel more forceful. You don't need extreme intake, just steady hydration across the day. Next is meal timing. Many people do better with their last large meal at least a few hours before bed, and a lighter evening meal if reflux or bloating is part of the picture. Third is sleep posture. If reflux is likely, a slight upper body incline can help, and avoiding tight clothing at night can reduce pressure. Fourth is stress downshifting. A short wind-down routine, dim lights, a few minutes of slow breathing, and a consistent bedtime can reduce adrenaline spikes. Finally, build a trigger map. Track 3 things for a week: caffeine timing, alcohol timing, and late meals. You're not trying to be perfect. You're trying to identify your top 2 drivers so you can reduce palpitations with the least effort. Moving to slide 12. It's also important to know when palpitations deserve medical attention. Get urgent help if palpitations come with chest pain, fainting, severe shortness of breath, or a sustained, very fast heartbeat that doesn't settle. Those combinations matter more than the sensation alone. For non-urgent evaluation, consider a checkup if palpitations are new for you, increasing in frequency, waking you regularly, or happening with dizziness or unusual fatigue. A clinician may ask about thyroid issues, anemia, electrolyte problems, and medication or supplement use. They may recommend an ECG, blood tests, or a wearable monitor to capture the rhythm during symptoms. This is useful because different rhythms have different levels of risk and different management options. The goal of evaluation is clarity. Many people feel relieved when they learn it's premature beats or a benign pattern, and if it's something that needs attention, catching it early is better than guessing at home. Moving to slide 13. Let's tie everything together into a simple model you can remember.
Palpitations when lying down usually come from one of 4 buckets: mechanics, triggers, rhythm quirks, or stress physiology.
Mechanics includes blood return, pressure from the stomach, and left side positioning. Triggers include caffeine, alcohol, dehydration, and late meals. Rhythm quirks include premature beats that feel like a skip and a thump. Stress physiology includes the attention, adrenaline loop, and sleep disruption. Your job is not to diagnose the exact rhythm in your head. Your job is to notice which bucket is most likely for you and test one change at a time. If you want a starting point, choose the easiest lever: earlier dinner, less evening caffeine, a slight incline, and a 2-minute longer exhale routine. If your symptoms are frequent or scary, bring a clear description to a clinician: what you felt, how long it lasted, and what was happening right before. If you found this breakdown helpful, make sure you subscribe and comment with your experience. Do your palpitations feel more like A, a single skip thump, or B, a run of fast beats? This information is not a substitute for medical advice.